We can talk now to the Chair of Global Public Health at Edinburgh University, Professor Devi Sridhar. Thank you so much for being on the programme. The Prime Minister, of course, laying out his plan for lockdown easing tomorrow. How cautious do you think he needs to be, and what do you think can happen?
Well, the thing to say is there's light ahead, and we should be optimistic because of the vaccines as a medium to long-term way out of this. If we look at Israel, we are seeing that once they have gotten down to vaccinating those in their 20s and their 30s, they're seeing actually that numbers are falling. And so there is a way to suppress this virus and to stop severe disease with our vaccines. However, we are a far way off from vaccinating people in those age groups, hopefully, as the health secretary said, by the summer. So the question is, how do we ease restrictions in a one-way process? We don't see a third wave over the next few months while the vaccine's rolled out. And that requires a strong test, trace, isolate system, especially supporting people in isolating who are testing positive, as well as mass testing to really hit higher prevalence areas.
Younger children in Scotland and Wales are going to be returning to school tomorrow, returning to the classroom tomorrow. It feels like in England, the ambition is to get all schools back to all pupils on the 8th of March. Who do you think has got the right approach?
Well, I'm obviously biased because I advise the Scottish Government on their education policies. And so I would agree what we've done here, which is tomorrow having the younger kids go back to assess after several weeks what has been the impact on transmission, what have we seen in schools. And we were learning from Denmark, who are ahead of us several weeks and who also have the new variant. The new variant is creating uncertainty, which means we need to go more cautiously. So there is a huge risk with bringing back all kids at the same time and then having to shut schools again. And we're trying here to move slowly, to move cautiously and get kids back, as many kids as possible, but in a slow, staged, phased way. And with testing. The other thing I'd mention, and it's an easy win for, I think, England, is in Scotland, we have allowed children under the age of 12 to play outside in groups up to 13. Only 2 adults can be there, but children can play in groups. So we've seen children doing sledding, tennis, football, out in parks. And this gives kind of outdoor play and also a form of kind of physical education. And that is an easy win because we know transmission outside is minimal and the mental health benefits are huge.
You talk about the vaccine rollout going well. We heard just a moment ago from William Hague, who said that once everyone over 50 is vaccinated, the top 9 priority groups, which we're expecting by mid-April, he says there wouldn't be much justification for keeping restrictions on people. Once this group is protected, given they make up 99% of deaths of COVID, it does feel to many people, I suppose, that there is a good case for lifting restrictions.
Yeah, I think we all want to lift restrictions as quickly as possible. I mean, I'm craving going out to a party or somewhere outside my home. But I think the thing to remember is what gets us with this virus is the hospitalization rate and how many people are susceptible. And the hospitalizations do go down to people in their 30s and 40s, which means that is what we're really going after. Of course, the deaths, but also the hospitals being full and not being able to provide routine care for all the things we need the NHS for. And so I'd say, of course, we want to lift restrictions, but it has to be down to the prevalence of the virus. Have we got it low enough? To testing positivity, are we testing enough, finding cases, as well as are we actually vaccinating those most at risk of hospitalization? And learning from other countries such as Israel, once they vaccinated their over 60s, they found a lot of under 60s in hospitals too. So we have to be kind of realistic of what it's going to look like for the next few months.
And what does the data show on the impact of the vaccine? Are we starting to get any indication yet that it's having an impact?
Yes, I think we're definitely seeing a reduction in deaths in older age groups, people in over 80s, since that group has been covered, over 70s. And we know, to tell people, a year ago, we didn't even think we'd have a vaccine. And now we have several, and the effectiveness is astonishing, especially of the mRNA ones. And so we are in a strong position to stop severe disease. And even it seems like glimmers of hope for stopping transmission. So I think where we're heading with this, people say, when is the pandemic going to end? Well, there's a real chance to drive the numbers super low using vaccines, using outbreak response. And then it's time for Britain and along the way to look across the world and say the pandemic will only be over if we look at poor countries, fragile states. 130 countries don't have any vaccines at all right now. And so it's a dual responsibility, both at home but also abroad.
You mentioned 130 countries without any vaccine, which clearly has big implications for the global fight against COVID. But at the same time, many people in the UK would say that we shouldn't give vaccines away until every adult has had at least 1 dose. What do you think the right thing to do would be?
This is a really tricky one, and I think it comes down to 3 arguments why we have to be vaccinating at home, but also looking abroad. And the first is a moral one. Is it right to be vaccinating people in their 20s and 30s here when you have health workers dying in Africa because they can't get access to a vaccine? The second one is actually self-interest. We know that this virus will mutate. We have seen mutations in South Africa and in Brazil, which can reduce the effectiveness of our vaccines. So if we want to be open to the world and have people coming in, then we need to make sure we're actually, watching out for variants coming in, which will emerge if there's uncontrolled spread of the virus in other places. And the third is we are seeing Russia and China donating their vaccines to low-income countries for clear geopolitical reasons. And so we've heard, now with the G7 going on, that actually, there is concern about what will it mean for the influence of European and North American countries if China and Russia are seen as being the most reliable support rather than the Western world.
OK, Devi Sridhar, thank you very much, Professor Devi Sridhar there.